Welcome to Compassionate Conversations. The goal of our podcast is to explore topics related to serious illness. And Core Compassionate Care exists to be a supportive presence for life's journey. We can provide care and support wherever a patient may be on their journey with a serious illness. And Core Compassionate Care began as Hospice of Rockingham County in 1987. While our name changed in late 2023, we are still the local provider the community has always known. We'll always be there because we've always been here. Welcome to this edition of Compassionate Conversations. I have an awesome group of people joining me today. I have Teressa Townes, who is our Director of HR, Flavel Collins, who is our Director of Marketing, and Jeanne Slayton, who is our Growth Team Leader. Thank you all so much for joining me today.
Thanks for the opportunity.
Absolutely. We have so many exciting things to share with you all today. And Core Compassionate Care has been named to the best places to work in healthcare for the 4th consecutive year. We're going to share how our quality metrics measured by Medicare consistently meet and most of the time exceed state and national levels, and the fact that we have a 5-star rating from Medicare. As we have our conversation today, I really want us to unpack how all of those things impact one another. But for the most important thing that I want us to get across to our listeners today is how all of those things combined bring value to the patients and families that we serve, our referral sources, basically the whole community. Okay, so Teressa, let's get started with you. From an HR standpoint, what are some of the key things that we do at Ancora that make our employees feel valued and supported? And that's where that best places to work in healthcare comes in.
So I think we can all agree that we recognize the fact that our employees are the heart of what we do, right? So just, I think that personal touch with them, just like the personal touch that they give our patients, very intentional about creating a culture of openness and respect. I feel like we are very unique in that we are concerned about how they feel and their opinions. We value what they think about things, and you don't see that a lot. Mm-hmm. We do encourage our folks to take care of themselves just because of the nature of what we do. So we do encourage self-care because we realize that if you take care of yourself, then you're able to take care of patients, families, right, and each other. So
yeah. Extremely important. And you know, I had somebody ask me last week as I was sharing with them that we made this list for the 4th consecutive year, and somebody said, "Oh, is that a local list?" So, just a little bit about best places to work. Tell us what does that mean?
So, Modern Healthcare does this every year, and it is a twofold process. There's the employer assessment where they ask us everything from about our insurance, our personal leave that we offer, and then there's the employee survey where folks get the opportunity to express how well we take care of them.
Right.
So very proud to say that this year we are number 3 in the nation.
In the nation.
In the nation.
That's incredible, really, for the whole county,
Yeah.
even just aside from what we do and how we take care of people. But to know you have a healthcare provider in Rockingham County that is number 3 in the nation, that is awesome. So a lot of this survey, of course, what it's looking at is how well we support and encourage and how well we care for our employees, as you were saying. So, and it looks at employee engagement. Engagement doesn't necessarily mean happy. If I just say employee engagement, What does that mean to you?
So, employee engagement really is about how invested are you in your organization and in your role within the organization. So what we recognize is that if you're engaged, you're motivated, you're going to be providing that special touch to your patients and families. And then, that trickle down effect of the employer taking care of the employee, then the employee taking care of patients and families.
Yep. Okay. So it has that high employee engagement has a direct, it directly influences the care that we provide for our patients and our families.
Absolutely, because, we've all been, let's say, just out to eat. And you can tell right away whether somebody enjoys doing what they do, right? So, yeah.
And it's interesting you brought that up because that's the service industry, but I feel like that is certainly what we are too.
Absolutely.
Whether we're providing patient care at the bedside, we're still serving that patient and family, right? And you're right, that is, you can't fake that.
No, you can't.
Yeah. So, but what do you think makes our culture here at Ancora different from a larger organization?
I think it's the fact that we are purpose-driven and mission-minded. And I think that makes a difference. Our mission is to be a supportive presence for life's journey. And I always tell people that this work, I think you're called to it. It's not just a job. You have to be called to it. And I think that because we have tried to create a culture of taking care of each other, we can do a great job of that spreading out into our community. So,
and most places, organizations, no matter what work, they've got values framed and on a wall, right?
Absolutely.
Like, what are your core values, or what's the organization's mission? But it's certainly we live out those values. I feel very confident in saying that, and we talk about that all the time to all staff. We have peer-to-peer value recognition, and they get a chance to highlight their coworker, and here's how they're living out this value or truly living out our mission. So, well, let's switch gears just a little bit. We're talking about employees, but how does being a best place to work as the director of HR, how do you think that helps us attract and retain compassionate caregivers?
So, you talked about our values. So I feel like, when folks see that, we're going to be attracting people who share those values of integrity and respect, teamwork, excellence, just some of our values. And then for those who are already here, realizing that you're not just a number, and I think that causes you to want to go that extra mile and recognize that you are a part of making us a best place to work. So,
right. Yeah. And that's a huge point right there. That's not, when we can say, hey, we've made this list for the 4th consecutive year, it's not a leadership or a team leader. It does truly take everybody throughout the organization contributing to that culture, right? And helping to maintain that. So, well, thank you for that. With hospice, we have more than the hospice service line. Of course, we offer hospice and serious illness care and our counseling center, so behavioral health. But with hospice being holistic care, that's how that whole benefit was created by Medicare, so we take care of that whole person. That's how we do it on the inside too, I feel, with employees. Listening, giving them a space to be heard, but truly caring for that whole person.
Absolutely.
So then they can pay that forward.
Yeah.
So thank you. I appreciate that. So Flavel, let's talk about some marketing things. With all of these things put together, the high quality metrics, best places to work. But how do, when you think about national recognition, so our 5-star rating for Medicare and then best places to work, how do those national recognitions shape the community's trust in Ancora?
Well, that's a good question. I think the two different accolades. You've got the Medicare 5-star rating, and you've got best places to work. I think those both signal to the community, number one, there is excellence in care that we're providing, but we're also creating a very strong culture internally in taking care of our staff. And those two pillars together drive quality care. So I think I believe it is reassurance to the community as to the quality of care that we provide.
Well, and how often do you go, no matter what you're purchasing, where you're going, how often do we go and check reviews? You know, we look at star ratings for everything else under the sun. And it's not easy to obtain this 5-star rating. And I'm not stealing your thunder, but we can talk about it more than once. But people need to know we are the only 5-star hospice organization now in our service area, which is Rockingham County, Guilford County, Stokes, and Caswell County.
Right.
So how incredible is that?
Right.
When you know there is an organization that can provide your care that has the highest rating that you can possibly have.
Exactly.
And I think the fact that we are the only one, obviously that sets us apart, but it in my mind makes you think, well, golly, it's not so easy to obtain. You have to work hard, right?
Right.
Yeah. So now, all cards on the table. We know we're not the only hospice functioning in Rockingham County, right? Competition is certainly a thing. Competition is not a bad thing. I think it helps everybody be better. You want to stay, on the top of your game. But we don't belong to a bigger health system as one of our competitors does. So how do we communicate from a marketing standpoint that bigger doesn't necessarily mean better?
Right. Well, if I'm out speaking to groups or doing information booth at a health fair, things like that, I not only emphasize our quality scores, but I also emphasize our local roots. November is our anniversary month. We're 38 years old this month. Started out as Hospice of Rockingham County. Changed our name 2 years ago, and that's all that was. It was a rebranding, a renaming. It wasn't a change in ownership or anything like that. But I emphasize to folks that, we are your local hospice. We are the hospice that was begun by, 33-member task force in this community that saw the need for a hospice. And we've never strayed from those roots. We stay true to our roots in that we are a local provider, the local provider, and we want to take care of our community. And I think knowing that is peace of mind for a lot of folks. That because being in a smaller community, especially in Rockingham County, we see it on a relatively regular basis. In that, somebody says, "Oh, well, we've admitted someone who was my third grade teacher," or there's a lot of local connection. And let's face it, if you're talking about needing hospice care or serious illness care, that's a very vulnerable time.
Sure.
And when you know someone personally that works within an organization, I think that adds a lot of peace of mind to the situation, to know that, well, that's where, so-and-so works. I know we'll get good care. So we do have the national accolades, but we also have our local roots that mean a lot to a lot of people.
And starting off as Hospice of Rockingham County, and it was just hospice. And then as Hospice of Rockingham County, of course, we added Gibson House, right? And then we have the rebranding, so now we have more service lines so we can care for people in different ways. Our employee base has grown to 98, I
Yep.
think it is, employees. So, but now we're back to the intentionality of keeping that small town hospice feel. And I think we do a very good job of that inside and outside of the organization. But there is something to be said for that. Now, it has been a couple of years, but Encore Compassionate Care is still a new name. And of course, we get asked a lot, well, you were Hospice of Rockingham County? Yes, so people make that connection. And, we'll just take it as a compliment. We have had a competitor that said, oh, yes, we're Hospice in Rockingham County. So I would encourage everybody to listen very carefully and make sure, because people have a right to ask for us by name, but they need to make sure they're getting exactly what they asked for, right? But we'll take that as a compliment. Let's talk about sales and when you're talking to referral sources and things like that. So, Jeanne, when you're meeting with referral partners or maybe even with families, because you certainly do have conversations with lots of families, how do all these recognitions come into play with them? The 5 stars, the quality metrics, all of that.
I think it depends on which group I'm meeting with, but with referral partners, we are so blessed in this county, in our service area, to have providers, long-term care facilities, assisted livings, all of these places that care for our community that want the best for their patients and their residents because they provide the best care too. So they want to find partners that are going to do the same. And our beautiful 5-star Medicare rating and our best places to work reassure them that the care that they're providing, that is exceptional, will continue when we partner with them. And so being able to talk to a physician and say, you're doing a great job. We want to partner with you. We aren't going to take that away from you. We are not going, you can stay the attending, you can stay involved. All of those things are really important to our providers that we work with. So knowing that they're going to get, their patients and their residents are going to get the same exceptional care that they deliver makes it so much easier for them to partner with us.
And that's something else that's unique about a rural setting. It's not unusual for some of these primary care physicians to have been that person's physician for
Birth.
30, their birth to
Now.
Exactly.
Yes.
And so how reassuring it would be for them to say, hey, this, when we work with Encore, that's just going to be an extension of what I've been delivering to this person.
Yeah, I mean, we have generations. We have providers who have seen generations of families and taking care of them. And so, finding resources for their patients that help extend their care is important, and they want to find the best ones for that. So partnering with those guys to be able to do that is actually my privilege. Like it is my honor to work with these guys, and we work, coming back to that, mission and our values. One of our values is communication as well. And so one of the things that I think that we do a little bit differently or uniquely with all of our referral sources is actually sit down with them and have a conversation to hear about what are your pain points? What do you need? How can I help you? How do you want us to communicate with you? How do you need us to do X, Y, and Z and all of those things? And then design a care plan, so to speak, much like we do with our patients and their families, with each of our referral sources to make sure that we're doing what they need. So we do that with our employees, we do that with our coworkers, we do that with our referral sources. We do that same intentional care with our patients and families too.
So in your role in particular, you come in contact, I'm sure, with our competitors more so than the 3 of us would. So tell me, do you ever have an opportunity with referral partners to actually share our quality metrics side by side, and what kind of reaction do you get?
frequently. I don't think that a lot of our referral sources, but also just people out in the community, understand what that 5-star is and what that's based on and what those metrics are and how they're scored. And I mean, the whole big picture. So being able to say, hey, let me show you. This is how we provide this care. This is what it's based on. 90% of our patients receive a visit in the last 2 days or 2 of the last 3 days of their lives by either an RN or a medical social worker, and explaining all of the pieces that go into that metric that really truly sets us apart, because it makes my heart hurt. The national average is less than 50%. The state average is right about 50 something, and our competitors are in the 60s. We're in the 90s, and that takes intentional care. That takes communication. That takes trust between the team. That takes all of those things that we do so well, and we can show that our care is exceptional. So having the time to explain why and where these numbers come from and what it truly means makes it make more sense.
Absolutely. So is there a particular story or example that you could share that shows how our team's excellence directly impacted a patient, or maybe even directly impacted a referral source?
I actually have a referral source actually just reached back out to me today to follow up on a conversation that we had last week and what they were looking for, and this was a specific provider, and I was able to go back to that provider and say, this is what we did, this is our plan, this is how we're going to all of that, and that specific provider was so grateful for us taking the time to send somebody out to the patient's home to have conversations about what your options are and what that looks like, and then for us to circle back to her and let her know, this is our plan going forward. This is how we're going to keep you in the loop. All of those pieces and parts. A family that I just spoke with actually a couple of weekends ago was a gentleman that we provided some care for a family member of his. And he said the biggest thing for him was while he was caring for this family member, and he had no problems doing it, having us coming in to help support him meant that he didn't have to be a caregiver quite as much. We can't take that whole burden off, but we can help relieve some of that burden. We can give them some time to just be a family member, to just be a spouse, to be a brother, to be a sister, to be whatever that is, and not just the caregiver. So to have that space and that time to create those memories and all of those things is so important.
Yeah. And internally, as we think about best places to work and quality metrics, and as we connect those dots, because I think that has to be very intentional to keep it in front of everybody. Why is it important? Why do we do the things that we do? My office happens to be in Gibson House, and so it enables me to have some beautiful conversations. Sometimes they're quite unexpected with family members that can stick their head in my door. But right before we came in to have this conversation, a gentleman stopped in, and I had spoken to him a couple of days ago, and he's thanking us for his loved one's care. And I said, anything that we're missing? Or is there anything that we need to pay attention to? And he kind of smiled and he said, Lynn, you asked me that 2 days ago. And I said, if I see you tomorrow, I'm going to ask you again. And he kind of laughed and he said, you all have a 5-star rating for a reason. And you just have to sit with that for a minute, not because we just want to be braggadocious about it, but when that comes from a family member, that lets you know that all of our employees are delivering the best at the bedside. Our support services, our social workers and our chaplains are delivering that support that you just mentioned to the family members. Our hospice aides, our volunteers, every piece of this team, But then the folks that are not at the bedside, the medical record folks, the billing people, the sales people, everybody, all having to be the best of the best.
And people are paying attention.
People are paying attention.
And I think asking that question to both our families, to patients too. What else can I do for you today? Our referral sources, our community partners, all of those things is something that also sets us apart. I don't hear that question being asked by other organizations, but being very intentional, asking that question, how can we do this better? What else can we do? All of those things. And then actually turning around and taking that and doing it. Answering those needs, I think, is something that truly sets us apart.
Yeah. I think that adds a level of transparency. We're always striving to be better. Yes, we're going to ask you, what else can we do? How can we better? How can we be better? Because we don't want to just be a hospice providing care. We want to be the best hospice providing the best hospice care.
Always.
In the community.
Always. And that will be evident as our quality metrics stay as high as we maintain, and Cora maintains their position on this best places to work, and we maintain those 5 stars. So that was a beautiful way to wrap that up. So, I just thank you all so much again for this conversation, and I hope it's been helpful to kind of connect the dots as to why we are so intentional on the inside and care for and build that organizational culture that is so important, so it helps us serve that community even better on the health side. So thank you all so much. Thank you so much for joining us today for Compassionate Conversations. If you would like any more information, you can always go to our website at www.ancoracc.org.